How to relieve knee pain with simple techniques. In today's video, we'll guide you through a simple but effective technique to help relieve pain in your knee. Now, keep in mind, this method is for general knee discomfort caused by tight muscles or poor circulation. If you have a serious injury, such as a torn tendon or ligament, or a bone fracture, you should seek professional medical attention. But for general pain, this method can provide noticeable relief. Step 1. Focus on the opposite leg. You might be wondering how treating the opposite leg could help your knee. The secret lies in the connection between the muscles and nerves across the body. The body operates in a balanced, interconnected way, meaning that by working on muscles on the opposite side of the pain, you can release tension, improve circulation, and promote healing in the affected area. So, let's start by focusing on the muscles of the opposite leg. If your left knee is hurting, we're going to target the muscles in your right leg. Specifically, we're going to work on the quadriceps, which are the large muscles in the front of the thigh. The quadriceps extend the leg and play a key role in stabilizing the knee. Step 2. Use a tool or your hands for massage. You can use your hands or a massage tool for this technique. A massage tool might be easier for applying consistent pressure, but you can still get great results with your hands. Begin by gently massaging down the center of the thigh muscle. This is where you'll focus your attention. Step 3. Work the muscle from mid-thigh to the hip. To effectively treat the muscle, press gently but firmly into the middle of your thigh. Slowly move upwards toward your hip, working your way along the muscle fibers. You might feel some tight spots or knots, which is normal. Take your time to work through these areas of tension. By targeting these spots, you'll help release the buildup of tightness and improve blood flow to the knee. As you work up toward the hip, make sure to stay focused on the area closest to the hip joint. This is crucial because the muscle that runs along your thigh connects to your hip, and relieving tension here can help alleviate pain in the knee. Step 4. Focus on the vastus lateralis. There's a specific muscle, the vastus lateralis, located on the outside of the thigh. It runs along the outer portion of the quadriceps and is important for knee stability. You'll need to shift your focus slightly to the outside of the thigh to target this muscle. Use the same technique, applying pressure along the outer thigh, focusing on any tender spots. This muscle can often be a source of discomfort, especially if there's any imbalance or tension in the leg. By working through this area, you're helping to relieve the pressure that could be affecting the knee joint. Step 5. Address the outside of the leg. Now let's move to the outside of your leg. There's a tendon sheath and a smaller muscle that often gets tight, contributing to knee discomfort. To target this area, gently press and massage along the outside of the leg, moving up into the hip. You'll likely feel some discomfort in this area, but it's important to work through it. This is where you may want to use a foam roller, especially if you're able to lie down and roll your leg gently over the roller. This technique helps release tension in the hip and thigh, which can have a direct impact on knee pain. Step 6. Rolling for deep tissue relief. If you're using a foam roller, start by lying on your side. Position the roller beneath the thigh and slowly roll it from the knee up to the hip. Make sure to focus on any areas that feel particularly tight or tender. This motion helps loosen the muscles and encourages blood flow to the knee. Spend a couple of minutes working through these areas, and you'll start feeling the release. Step 7. Repeat and assess your progress. Once you've worked through all of these muscles, take a moment to move your knee and assess how it feels. You should notice a reduction in pain or stiffness, as the tension in the surrounding muscles has been relieved. Repeat this process once or twice a day for a few days. If the pain persists, it's important to consult with a healthcare professional to rule out any serious issues, like a tear or injury. While these techniques can offer significant relief for many people, they may not be effective if there's a more serious underlying issue. By following these steps, you can relieve knee pain by addressing the root causes in the surrounding muscles. This simple routine requires no special equipment, just some focused attention on your body's interconnected muscle groups. If you don't experience improvement after consistently working through the routine, it's time to get a professional assessment to ensure there's no underlying damage to the knee. But for general pain caused by muscle tension, this approach can provide real, lasting relief.